is excision of the kidney. Nephrotomy is a surgical incision into the kidney. Nephrostomy is the creation of a permanent fistula leading into the pelvis of the kidney. Nephropiellostomy, temporary nephrostomy tubes, are occasionally used to divert urine when obstructive uropathy occurs or when the proximal ureter has been avulsed from the kidney. Pyelolithotomy is an incision made into the renal pelvis and proximal ureter to remove calculi. Ureterotomy is an incision into the ureter. Neoureterostomy is a surgical procedure performed to correct intramural ectopic ureters. Ureterostomy involves implantation of a resected ureter into the bladder. Renal disease refers to when there are morphologic or function lesions in one or both kidneys. It does not refer to severity or extent. Chronic kidney disease, CKD, the most common renal disease of dogs and cats, refers to patients with a permanent loss of functioning nephrons that have had renal damage, with or without a decreased glomerular filtration rate, GFR, for at least 3 months, or that have had a 50% reduction of GFR for at least 3 months. Renal failure is when the kidneys are not able to maintain excretory, regulatory, and/or endocrine function, with subsequent retention of waste products and abnormalities in fluid, electrolyte, and/or acid-base homeostasis. This generally happens when 75% or more of the nephrons become non-functional. Azotemia is defined as an increased concentration of nitrogenous waste products in the blood. Uremia is the clinical syndrome associated with sufficient loss of functional nephrons. Chronic renal failure, CRF, is a progressive disease that occurs in patients with CKD with significant clinical signs: polyuria, polydipsia, weight loss, decreased appetite, and laboratory findings, azotemia, anemia, proteinuria. Acute renal failure, also referred to as acute kidney injury (AKI), refers to patients that have an abrupt decline in renal function, which leads to retention of nitrogenous wastes. Ectopic ureter. Ectopic ureter, or ureteral ectopia, is a congenital anomaly in which one or both ureters empty outside the bladder. Extraluminal, extramural, ectopic ureters are those that completely bypass the bladder. Intraluminal, intramural, ectopic ureters course submucosally in the bladder to open in the urethra or vagina. Ureteroceles are focal, cystic dilations of the distal ureter that may be ectopic or intravesical, orthotopic. Ureterocele in the bladder of a dog. The contralateral ureter was ectopic. Sign and symptoms: urinary incontinence, pyelonephritis and cystitis. Hydroureter suspect ectopia of ureter in any young animal that has a history of incontinence since birth. Suspect this in older animals with lifelong urinary incontinence, more commonly diagnosed in female dogs than in males. Diagnosis: contrast radiography, ultrasonography. Treatment: medical management, aimed at treating the urethral sphincter incompetence. Drugs used are phenylpropanolamine, ephedrine, imipramine, diethylstilbestrol. Surgical techniques: it includes the following: neoureterostomy, ureterostomy. Neoureterostomy is performed for intramural ectopic ureters. A. Perform a cystotomy and make a 3 to 5 mm longitudinal incision through the bladder mucosa into the ureteral lumen. B. Using absorbable suture material, suture the ureteral mucosa to the bladder in a simple interrupted pattern. C. Place a 3.5 or 5 FR catheter into the distal ureter. D. Distal to the new stoma, pass 1 or 2 non-absorbable sutures from the serosal surface circumferentially around the tube, staying beneath the mucosa. Ureterostomy. Ureterostomy is performed when the ureter is extraluminal. Ligate the ureter and transect it. Place a stay suture on the proximal end of the transected ureter. Incise the bladder mucosa and create a short, oblique, submucosal tunnel in the bladder wall. Spatulate the ureter end and suture it to the bladder mucosa with absorbable suture. Uroabdomen, uroperitoneum, is a condition where there is accumulation of urine in the peritoneal cavity due to leakage of urine from the kidney, ureter, bladder, or proximal urethra. Rupture of the bladder is the most common cause. Also due to blunt or penetrating trauma, e.g. automobile accidents, penetrating injury from the fracture fragments of pelvic bone. Remember that if the rupture of the bladder is small or on its dorsum, leakage will happen only when the bladder is fully distended. In such cases, the dog may void urine normally. Diagnosis: suspicion from history of trauma, peritoneocentesis, smell of urine in the fluid, and the creatinine level will be greater than that of serum. From physical examination findings: confirmatory diagnosis, plain/contrast radiography and ultrasonography. Treatment: medical management. If the animal is hyperkalemic or uremic, medical treatment should be initiated. Peritoneal dialysis is preferred in such situations. Surgical treatment: repair trauma of the urethra by anastomosis. If the urethra is not completely transected, it can be allowed to heal over a urinary catheter. Rupture of the ureter can be corrected either by anastomosis or by reimplantation into the bladder. Rupture of the bladder, mostly at the apex, can be corrected by apposition of the edges. Urolithiasis. Urolithiasis: renal, ureteral, cystic, and urethral calculi. Urolithiasis means a condition of having urinary calculi or uroliths. Can be any of the following: nephrolith, calculi in the kidney; ureterolith, calculi in the ureter; cystolith, calculi in the urinary bladder; urethrolith, calculi in the urethra. Clinical presentation: some breeds have higher incidence due to metabolic abnormalities, e.g. Dalmatians. Signs: depends on whether the stone has caused obstruction or associated infection is present. Renal and ureteral calculi. Urolithiasis refers to the condition of having urinary calculi or uroliths, kidney, ureter, bladder, or urethra. The condition of having renal or ureteral calculi, i.e., nephroliths or ureteroliths, is nephrolithiasis or ureterolithiasis, respectively. Nephrolithotomy is performed to remove renal calculi from the renal pelvis by incising through kidney parenchyma. Pyelolithotomy is an incision into the renal pelvis and proximal ureter. Ureterolithotomy is the removal of calculi from the ureter by incision, ureterotomy. A staghorn calculus is one that occurs in the renal pelvis and extends into the diverticula. Nephrolithotomy is also known as lithonephrotomy. Renal calculus in a dog. Radiopaque renal calculi in a cat, arrows. Clinical presentation: some breeds have higher incidence due to metabolic abnormalities, e.g. Dalmatians. Signs: depends on whether the stone has caused obstruction or associated infection is present. Renal calculi, hematuria, flank pain, or renomegaly, polyuria and polydipsia. If the animal has pyelonephritis. Diagnosis: from symptoms, radiography and ultrasonography. Treatment: treat the underlying infection. If the calculi is associated with obstruction, surgical removal is essential. Surgical removal include the following: nephrotomy for removal of renal calculi, cystotomy for cystoliths, urethrotomy for calculi in the urethra. Treatment: treat the underlying infection. If the calculi is associated with obstruction, surgical removal is essential. Surgical removal include the following: nephrotomy for removal of renal calculi, cystotomy for cystoliths, urethrotomy for calculi in the urethra.